The crucial role of oxygen in your bloodstream is fundamental, as it is the core of life itself. When you breathe in oxygen via your lungs, it is quickly taken up by red blood cells and distributed throughout your body, supplying essential energy to all organs, tissues, muscles, and cells. Regrettably, numerous individuals experience diminished oxygen levels in the blood, a problem that can gradually harm the heart, brain, and liver. Several reasons can cause this decrease, with long-term respiratory issues such as asthma, COPD, bronchitis, or pneumonia frequently to blame. Smoking habitually influences the blood's ability to retain oxygen by adversely affecting hemoglobin. Moreover, heightened cortisol from stress or anxiety may trigger increased breathing, disrupting the oxygen-carbon dioxide balance in the blood. Snoring and sleep apnea can further reduce oxygen levels. Excessive intake of sugary foods can result in a more acidic blood, decreasing oxygen levels. Furthermore, insufficient vital nutrients may lead to anemia or reduced levels of antioxidants, which, if left unattended, may progress to hypoxia, bringing about severe harm to the body's internal organs. In this video, we will examine 9 clear indications and manifestations indicating lowered oxygen levels in the blood. It is crucial to seek medical advice if you experience these signs. The first indications, commonly called air hunger, involve a strong need for extra air because of low oxygen levels, causing sensations of tightness in the chest and frequent deep breaths. Blood acidity obstructs oxygen supply, causing this distressing feeling of being out of breath. Feeling lightheaded or having notable weakness when standing or doing light tasks is another indication. These signs could indicate a lack of oxygen in the blood, leading to brief loss of balance or passing out, especially near the periphery of your visual field. These signals suggest that your muscles lack sufficient oxygen, causing significant weakness. An accelerated heart rate, typically ranging from 60 to 100 beats per minute while at rest, may additionally indicate reduced oxygen levels. To check the pulse rate, place 2 fingers on the inner wrist. An increased resting heart rate or a noticeable heartbeat at rest indicates the heart's difficulty in pumping extra blood to compensate for the decreased oxygen intake. Proceeding to the following indication, muscular spasms and pain in the chest may indicate a lack of oxygen in your blood circulation. If you frequently experience these discomforts, it could be beneficial to include foods rich in electrolytes, vitamin E, and B vitamins in your diet to enhance blood oxygen levels. The video will explore ways to increase oxygen levels. If you appreciate this information, please show your support by liking the video, subscribing for more health tips, and enabling notifications. The 5th indicator is the feeling of heavy legs when going upstairs or walking up a slight slope, causing shortness of breath. It may be because your blood lacks sufficient oxygen. A sense of great heaviness in your thighs and calves could indicate that oxygen is not reaching these muscles properly. This weakened cardiac state or deficient vitamin C or E may cause muscle tiredness and relate to heavy legs feeling. Examining your nails could reveal hints for the 6th indication. Healthy nails are pink, smooth, and show faint lines indicating proper oxygen levels. Moving on to the 7th signal, you may observe alterations in your skin tone. Healthy skin typically appears evenly pink, but if you notice bluish or grayish tones on your lips, inside your mouth, or on your fingertips, it might indicate cyanosis, a sign of low oxygen levels. This color change requires urgent medical care, revealing serious oxygen deficiency. The 8th sign is cognitive impairment. The brain relies on oxygen for proper functioning, so inadequate levels can lead to issues with focus, memory, and decision-making. Mental haze, disarray, or a sudden drop in mental capacities may suggest that insufficient oxygen levels are impacting brain well-being. If your nails display a noticeable lack of color with a clear lighter band at the tip, this subtle clue might be warning you about the existence of anemia. This ailment indicates a deficiency of hemoglobin, a vital element in your blood that carries oxygen to the body's outer parts, such as the nail beds. Moreover, in case your nails are prone to frequent breakage, or you observe that previously faint vertical lines have turned into more noticeable ridges, these indications might also suggest anemia and potentially nerve injury near the nail bed. Arising from inadequate oxygen levels in your bloodstream is the development of a bluish coloration on the skin, a medical issue known as cyanosis. This usually presents as a blue hue on your skin or lips, and is a direct consequence of insufficient oxygen supply to the body's cells. Cyanosis may suddenly show up and is frequently observed together with instances of breathing difficulty. It's a severe and conspicuous indication that indicates the immediate requirement for medical help. The last sign we will talk about is confusion, which emerges when the brain doesn't receive enough oxygen. Indications could involve confusion, an intense feeling of tiredness, and a notable rise in irritability. These problems are often connected to a lack of vitamin B1, also called thiamine, essential for the health of nerves and the brain. The overconsumption of sugar and processed carbohydrates is a frequent cause of these deficiencies. If you have any of these signs, it's recommended to promptly consult a medical professional. A doctor might utilize a device known as an oximeter to assess your blood oxygen levels. A standard saturation level usually falls within the range of 95 to 100%. Yet, if the oximeter consistently displays a value lower than this range, particularly under 92%, it indicates a possible hidden health issue. One may buy a pulse oximeter for personal use, a handy and relatively cheap tool that attaches to your finger and gives an instant reading. Looking ahead, let's explore 6 key lifestyle habits that can boost your blood oxygen levels effectively. 1. Prioritize adding iron-rich foods to your meals, especially those high in heme iron commonly found in animal products. Fatty fish, shellfish, grass-fed beef, and liver are excellent options due to their high vitamin B12 content. This vitamin works together with iron to enhance the creation of red blood cells, thus enhancing the storage and delivery of oxygen in your body. 2. To increase your oxygen levels, it's crucial to reduce the intake of refined carbohydrates like sugary treats, fizzy beverages, and processed grains. These consist of grain-based goods, such as bread, wheat products, pasta, pancakes, and cookies, all of which deplete your body's antioxidants and lead to acidic blood, lowering oxygen levels. 3. Enrich your diet with foods naturally high in vitamin E to promote heart health and enhance oxygen delivery. Such foods include, but are not limited to sunflower seeds, avocados, the purest forms of olive oil, hazelnuts, Swiss chard, and a variety of leafy green vegetables. Consider supplementing with a potent form of vitamin E, known as tocotrienols, to reinforce your diet. 4. Develop a habit of leisurely walking in green spaces with abundant vegetation. Dedicate half an hour daily to light outdoor workouts. The physical movement, the clean air, and the healing scents from trees help boost blood flow and enhance oxygen levels. 5. Develop a routine of including low glycemic berries in your daily diet. These nutritious fruits, such as blueberries, strawberries, gooseberries, and acai berries, contain antioxidants and the beneficial compound resveratrol, recognized for enhancing oxygen levels. Moreover, keeping yourself hydrated by consuming at least 1 liter of mineral water daily facilitates oxygen exchange and promotes overall bodily functions. An ideal morning recipe fuses the powerful nutrients of berries with a pinch of natural salt, blended into effervescent mineral water to craft an invigorating and nourishing drink. This beverage not only enhances blood oxygen levels, but also restores essential electrolytes in your system. 6. Finally, engage in abdominal diaphragmatic breathing. This effective breathing technique entails placing one hand on your stomach and the other on your chest. While taking a deep breath for a count of 4, Make sure your belly expands and your chest stays still. Next, exhale slowly for a count of 6. This approach not only helps with air distribution in your lungs, but also reduces cortisol levels, promoting calmness and relaxation. Experiment with these techniques to see which ones work best for you. Sometimes, additional vitamin supplements may be needed to optimize blood oxygen levels. Take care, and see you in the next lesson.